Hello, my name is Professor Wendy Graham from Impact and the Soapbox Collaborative at the University of Aberdeen. For the last 4 weeks, we've had the privilege of being joined by visitors from the Gambia in West Africa and from Zaria in Nigeria, who've joined us as part of a fellowship scheme in connection with work on infection prevention. And as our visitors are just coming to the end of their stay, we wanted the opportunity to speak with them and to share the lessons they've learnt about infection prevention, which has been done very much in conjunction with NHS Grampian. And so I'm very lucky to be able to be joined now by Kebba Manneh, who's the CEO of the Jama Peace Foundation Hospital near Banjul in the Gambia. And Kebba's going to tell us a little bit about his experiences, both back in Banjul, but also about the learning process here whilst being with us in Aberdeen. So Kebba, thank you very much for joining us for this interval before you take the flight back to the Gambia, the sunny Gambia tomorrow. And of course, anyone who's survived 4 weeks in this part of Scotland has to be asked a question. What did you make of the weather?
Thank you very much, Professor Wendy. Personally, I think I've been very well prepared.
Okay.
I knew what I was going to expect.
Yes.
So I was really ready for it. I was told that the weather can be, you can expect the unexpected.
Yes.
So I'm very well prepared. I had the right dress, the right, materials.
Yes.
So notwithstanding, it has been very cold, just like you have said. My country is very warm.
Absolutely.
36, 37 compared to, sometimes minus something.
Yes, exactly. So you've survived.
It's an experience. I survived it.
It's an experience. And I certainly look forward to coming back to the Gambia where there's lovely heat and warmth at all times of the year and the sunshine that goes with it. So I look forward to seeing you back there, of course. So you've been with us for 4 weeks now. The time seems to have gone very quickly, and obviously this has been a fellowship done together with NHS Grampian. And for those who are listening to this podcast, perhaps you could tell us a little bit about the sorts of challenges that you face in your hospital, but also perhaps the sorts of challenges that the Gambia faces as well.
Thank you very much again, Professor Wendy. Like you said, Gambia is a small country. But small does not mean, that you can be without challenges. I think we have our own major challenges. And one of the main reasons of me coming here was as a result of the fact that there was what we call as an assessment that was done some time ago by Soapbox, trying to assess the situation of bad cleanliness in the Gambia. And the results of that assessment, reveal some things that really need to be changed. And I think that is the reason why, you've identified some of those weaknesses, and then some of us were identified to come and also see what we can learn here, what are some of the good things that we can learn here or see here that we can borrow and take back home. Not necessarily to do everything what we see here. We know there are resource implications, there are a lot of things, but then there are basic things that really we could start with that are really key, to improvement. So it has been a very fruitful 4 weeks, and it has been a serious food for thought, and we have learned so much lessons that we think we can really, make some at least improvement.
Right. So you think this whole issue about infection prevention on the labour ward, as you say, from that initial collaborative assessment we did together, there was a recognition everybody wanted to improve the situation. Sometimes the constraints are very basic, like lack of water. So practicing best hand washing is sort of difficult without water. But in your hospital, you've already made progress in that direction. And in fact, if anything, you were not facing the same challenges as some of the other places.
Just like you said, of course, yes, in my own particular hospital, we don't have issues related to water. And at some point we've started issues of hand hygiene, but then it is not as structured as we see it here.
Right.
We've not had a lot of guidelines as to or tools that will measure the level of compliance and the like. Well, we have them there, but then there has not been a lot of information as to why are they doing it.
Right,
how should they do it.
Right.
So these are some of the things that we have really learned here in these past 4 weeks, and this is something that really will make a lot of difference. Right. And my aim is to make sure that I make hand hygiene a culture
Yes.
work organization. So
Absolutely.
if you look at hand hygiene, it's not just about washing hands, but it has a lot to do,
Other things as well.
it embeds a lot of things. So that
Absolutely.
whatever we do, we really have to make sure that we are not a source of, causing infection to people.
Absolutely.
Yeah.
Prevention is always better than
Absolutely,
cure,
yeah.
as you well know from your own nursing and
Absolutely.
midwifery background.
Absolutely.
If we can, in those particular resource constraints, prevent things rather than having to deal with the serious
And then just,
complications.
in addition to that, we are all encouraging our mothers to come to use our services, to use our facilities at the hospitals.
Right.
Because we don't want any mother or child to die in the process of childbirth.
Of course.
But in as much as we are encouraging them to come to the health facility, there are a lot of challenges at facility level, one of which is the cleanliness.
Yes.
And then
Yes.
this has to be really addressed. If we're encouraging people to come to for institutional delivery, we want to save their lives. But if it is going to mean introducing infection to them, it's better they even stay at home. So we have a
Absolutely.
big
It's a
challenge
very
that we
difficult
really
one.
need to take care of. And then the best thing we can do is to go back to basics.
Yes.
To look at
Yes.
the basic thing. It's not about getting the art, the state of the art. Because even if you have, for example, you have a CT scan or you have some bigger machines, if the environment is not clean,
Yes.
it is only going to end up carrying dust. And in the long term, it will not even. So you would have spent millions of dollars on one item,
Yes.
forgotten about the basics.
The
So those
basics.
small things that we really think not very marginalized,
Yes.
their repercussions can be very serious.
Absolutely. Well, it's so good to hear that. And I know colleagues in the NHS, they sometimes would say, by comparison, we've forgotten the basics.
Absolutely.
Although we've got a certain level of hygiene, maybe we're concentrating on the wrong thing. So I think we've been learning from you and some of your insights as well. So you I know at various points you've particularly zoomed in on certain things that have struck you in the sort of 4 weeks that you've been here, things that you'll carry back. So tell us a little bit more about those things that really strike you from your exposure here.
They just, like I said, my head is almost full now. But then I just have to talk about some of the few things that I think really strike me here.
Yeah.
One thing is the impressive organization of work. The way people really, are placed to work, the way the seriousness of the people coming to work. And then the way they put people before themselves,
Right,
patients,
right.
putting patient-centered, this thing. And these are all issues that are really weak in our place. And then also we have not seen, we do have guidelines, but then most of our guidelines, they're just lying down somewhere, nobody's adhering to
dust.
them. Where
Yes.
they are, most of the time they are not available. But even where they are not being adhered to. We don't have clear-cut guidelines. We don't have, we have a lot of issues related to leadership problems. It's about, people taking responsibility.
Yes.
Of what are the things. But what we've seen here, people are applying, everybody at all levels, guidelines are being applied and everybody is adhering to guidelines. Everybody is working towards the goal. So, making sure that, you contribute your own, effectively towards, attainment of the whole goal.
Right.
So I think this is some of the things that we really, these are some of the good lessons that we really want to we have seen along the line the standard of care has been maintained at all levels, particularly the basic things, cleaning. So all these things, and then not all just about cleaning, but the proper way of cleaning.
Yes.
These are all the things that we've learned here. Like you've mentioned before, something can also be visibly clean, but it doesn't necessarily mean it is clean. So it has a lot, it has a lot of things that has to go with it.
Okay, very good. So you're going to be going back tomorrow, and I know your family and the rest of your colleagues are looking forward to. So what's the first thing you're going to do in terms of changing practice in your hospital?
Just like I said, when I go home, I'm just first going to take a 2 weeks rest. I just want to sit down and really assimilate all the things that I've learned here.
Okay.
Trying to find a way of how I'm going to approach. Of course, the ideas are there.
Yes.
But then, like I said, I am being identified by my board of directors, the Minister of Health and Social Welfare, to come here, and represent the country, because I'm the only person here. So I've learned so much and I've seen so much, and I think my experience so far has been enormous. So I will also try to take my time, try to see, really what is what I can implement and what can really make results.
Right.
This is about improvement. It's all about improvement because we need to move from one level to the other, and it's all for the benefit of the patients. We should look at them to see that at least, we should make the world, a better place for everybody. But then we have a lot of problems in our countries. People are dying, mothers are dying of deaths that are avoidable, that can be prevented. Children are dying of causes that can really be prevented. I think that is one. I just read about one thing along when I'm always going to your office area about the Lancet, which it says, over the years, women have been delivering, for people.
Yes.
It's time now for people also to deliver for women.
Yes.
So I think that is something. It's an inspiration that I have, and this is something that really I have taken, and it's going to be it's going to really be my inspiration. It's going to be my driving force.
Right.
You
are one of the most patient-centered people that I know, and I know that obviously as a midwife, a male midwife in the Gambia, and we don't have male midwives in some parts of the world, but you're very respectful already of the care, and it's very interesting to see in the Gambian context what a difference your hospital is starting to make as a sort of a model that others can try with the different challenges to try and emulate.
Absolutely.
But also, Kebba, the point of these visits is to learn from each other, and it's been a great privilege having you here. And I know the colleagues in the NHS Grampian that have been part of this scheme, we all would like to hear what your thoughts are. Words of advice. NHS Scotland or NHS Grampian has a different resource base from the Gambia, obviously, but we never stop learning, as you rightly say. So what are your words of advice back to us?
Thank you very much again, Professor Wendy. I know you have not just reached here. This is not a one-day journey. Yeah. It has taken a long, long days, several years to be here. But at least you've been here now, and then what we've seen here is quite impressive. All the issues related to, I'm not saying everything is 100%, but then, but then really, if I wish I can find myself in a situation like this. As a result of that, I would want to really give a word of advice to the NHS because, of course, in my country they said, in as much as the horse can ride, but you really need to stimulate, give him a little bit of distance so that it can still go on. And some of those few things that I may want to distinguish, the NHS should not lose sight of their, that collective responsibility that we really find, and then that patient communication strategy should be very well maintained.
Right.
They should not really compromise or whatever quality, second place to cost.
Right.
So those are some of the real issues that they should maintain those type of things because. At least like I just had a story. We should make the world a better place for, because you never know. It's a global world. We are all moving from one level. So these are things that we cherish so much. Transferring knowledge and skill to us is a matter of, it's a survival for yourself. It prevents you, it's a protection for yourself. I just had some people in my country last month. They are Rotary Internationals. And then we were talking about issues like that and then supporting health systems and the like. And they were a group. On the way, there is a group, they were about 4 in separate vehicles. One of the groups got an accident, and then they were brought to the same healthcare facilities.
Right.
So you can imagine,
Right.
But even before whatever happened, before you are flown back to your country, your first aid has to be taking place in a healthcare facility in a developing country or whatever. So these are some of the things that it is a collective responsibility.
Right. It's been a great privilege, obviously, having you here. And as you said at the beginning, Kebba, we'd started working together all about 18 months or so ago, doing that assessment of what the sort of challenges are.
Yeah.
And clearly we're hoping to carry on working with you and supporting your hospital and in yourself as you go forward with your improvement plans.
Yeah.
But are there particular things that you would like to see Soapbox with its partner in NHS Grampian that we should be thinking about to strengthen our relationship with you?
Yes, I think that is is in the right direction. But I just have a word of caution that this is a developing country, and we don't want issues of encouraging issues of dependency.
Yes, absolutely.
Whatever you do in a developing country, my country for that matter, in particular, you have to do it in a sustainable way. You know, you don't have to encourage cultural depend. Otherwise, once you are not there, you know, everything is also dropped again.
Yes.
So empowering people, you know, capacitating them, giving education to them, and like the way we've just trained here, it will go a long way in supporting the country.
Okay.
I would expect to see more Soapbox fellows in my country, you know, just to retain the memories.
Absolutely.
Because one person, I'm the only person, you never know what can happen to anybody. But at least we need to have the memories there, so that at least, you know, when we have 4 or 5 of us or 6 or so, I think that will go a long way in, you know, striking, you know, the revolution.
Absolutely,
so
the revolution, yes. A cleanliness revolution for mothers and babies, absolutely.
And the other issue also that I might want to also put forward is that retaining capacity in a country is very important. At least from here to Scotland, Gambia to Scotland is very far. It takes several hours. I would encourage Soapbox to support action, you know, research, you know, in a country, particularly in my hospital, so that at least we can be able to do our own inquiries, trying to do our own, you know, situational analysis, trying to come up with solutions to our own problems, and trying to, you know, inform policies as well. So if those things are in the country, it will also go a long way, not only to build the capacity, but it will solve the problems even in a quicker way than, you know, than waiting for you to come all the way here to come and solve the problem for us.
Thank you for emphasising that, because I think, you know, when we set up Soapbox just 2 years ago, the question of ethics and doing it in a sustainable way, but also in a way that ultimately you are redundant. Because if you really work in support of those on the ground, then the need for external technical assistance gets less and less as time goes on.
And the other thing is about, like, the whole thing is centered around infection control. By a country like mine, we don't even have a policy on infection control. I really need, I'm appealing to Soapbox to support my country. At least with technical assistance, so that at least we can be able to develop, because the policies and guidelines shows you the direction where you're going. Because at this point in time, you can do anything, but if you don't have a direction, you know, it doesn't make any distinct. So those are the sort of things that we really need to get people, you know, on board, so that we can get the ball rolling.
Okay, well, we look forward to this journey. As you said, if you don't know where you're going, any route will do. And so it's really important to have the direction sorted out, and we look forward to working with you.
You know, the course of maternity clinic champions really becomes a reality. And then I, for one, as far as my hospital is concerned, we want to champion that initiative.
That's excellent to hear, and it's been a great privilege having you here, and next time you'll make sure you leave some sunshine behind with us in Aberdeen.
Thank you very much.
And thank you very much indeed. Safe travel home. Thank you.